Hello, everyone, and welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst, and my co-host and a guest. So I'm going to let Faraday introduce herself.
Hey guys, Faraday Golembieski, nurse practitioner here at Revitalyze MD.
And Dr. Ibrahim, George Ibrahim, is from Asheville and Biltmore Restorative and does sexual wellness and aesthetics and has been doing all of that for over a decade, well over a decade, and is is a great source of expertise in the area. And so if you want to say a few words and introduce yourself.
You are too kind, Dr. Durst. I do appreciate that introduction. Dr. George Ibrahim. I was a urologist with Duke University Medical Center for about a decade or so, and did that before I started doing hormones and sexual wellness, and that's where I am now.
And today we'll talk about a little bit of our sexual wellness, vaginal laser rejuvenation. And before we even start, I do want to say like and subscribe because that if you like the content of, again, better sex and information pertaining to that, then you want to subscribe so you can get further notifications of a new podcast.
That's it. So hit the bell and share with friends.
Yeah, absolutely. All right. So let's talk about it. So vaginal laser rejuvenation, again, relatively new, but I have seen a ton of advancement in the last 2 years and a lot more knowledge about it, or at least inquiries about it. They come a little more informed. And so what do you think? Have you seen a big change too in that over the last couple of years?
Definitely, especially in aesthetics. We've been using it for lubrication, for tightening, but I think more and more women are seeing it as a way to improve appearance. Mm-hmm. And that to me has been a big change in my practice.
Yeah, That's true. We've seen that too. I think I've seen women come a little more informed.
Oh, absolutely.
Than in the last, and especially seems like that men were more aware of male sexual wellness and things we can do to improve erections. And now I think we have an equal amount of women actually pursuing it.
That are seeking us out for very specific treatments for very specific issues.
Yes.
It's exciting to see this change overall in women's health, because I feel like women have been kind of left in the dust when it comes to all things vaginal rejuvenation.
And I'd be remiss if I didn't bring up my urology background and saying, I love it for the stress incontinence improvement that it offers women.
Absolutely.
I think that's oftentimes overlooked because it is pitched mainly as a sexual wellness tool, but it's unbelievable as that, especially when you combine it with the O-shot as far as treating stress urinary incontinence, that kind of incontinence that when a woman laughs or coughs or sneezes or jumps up and down and leaks, that's you see that in pretty much every single woman who's had a vaginal delivery over the age of 45. And this laser is phenomenal what it does to help with that.
Correct.
Absolutely. We were doing research a few months back when we were doing a podcast on stress incontinence and for women. And one of the studies that we saw was pretty staggering, saying that like the number one recommendation by primary care neurologists were for women to put on a pad for leakage. As the number one treatment was like something staggering, like 70% recommended a pad. I'm like, I would have flipped out if my doctor said, wear a pad.
Yeah, that was the most frequent
That's insane to me.
Yeah. Do you want to talk a little bit about the different types of incontinence? And you mentioned stress, and maybe just touch in general on all the different types of incontinence and which ones these improve.
There's two main ones. There's urge and stress. Urge is, we would always use the example, a woman's at the back of the grocery store in the freezer section. All of a sudden she's on her tippy toes and she's looking for the bathroom, and she's running to get to it. And before she can make it to the bathroom, she pees or leaks. All right, that's called urge incontinence. Stress is when they've done something, and I don't like using the word stressful, but stress meaning they cough or they sneeze or they put some kind of abdominal pressure that exceeds the ability of the urethra to maintain continence, and they leak. That's the biggest incontinence that we see in women, especially women who've had vaginal deliveries. And if they're in menopause, the loss of estrogen is huge. I mean, once that urethra becomes not supple anymore, And once it loses its moisture, you're going to leak. It flabbergasts me as a urologist that the way a woman stays continent is that her urethra sticks to itself, like if you were dealing cards on a table. As long as the table's dry, if I just blow on the table, I'm going to blow all the cards away. But suppose somebody had left a drink on the table and they picked up their drink and there's that water ring. And I'm dealing the cards and one of the cards lands on that water ring. Well, if a big gust of wind comes through the room, all the cards are going to blow away except for that card laying on that water ring. That water has created an ability for that card to stick to the table. Coaptation is what it's called. That's what happens with the urethra. When the urethra is moist, it sticks to itself. And that sticking to itself is what keeps a woman continent. And so when she loses estrogen, she becomes dry. That becomes like a pipe, like the card on the dry table. You just puff a little puff and it blows it off the table. Puff,
I love
and
stories. Yeah.
And so, the laser, whether it's laser or radio frequency, but the energy that we deliver in the vagina helps with the blood flow and increases the moisture. And that in and of itself is a huge way of helping with incontinence, much less lubrication. And then as you go into later, tightening.
Well, and so basically, when we're talking about laser or vaginal rejuvenation, I think one of the most frequent things that, women are hearing about it because of stress, urinary incontinence, or the treatment of it, because that's what the laser companies can talk about, right? Because they can talk about it being a treatment for incontinence, but they can't talk about it being a treatment for sexual dysfunction.
Right.
And so that's where we come into play. So we get a lot of people that come in for incontinence treatment, but now we're getting more people that are coming in for orgasmic strength and dryness and increased lubrication and all those things. So that's the
becoming
exciting
less
part.
taboo to talk about.
Female
sexual health.
Yeah, and that's where we've seen a big change over the last couple of years. So getting to that point. So again, these laser treatments, and there's different ones, and we can talk about it. Ablative and non-ablative is one way to break those down. Most of those are basically applying heat in some way to the whole entire vaginal canal, and then on the outside as well. And so with that heat, again, you guys can join in at any point, but like increase collagen, elastin for tightness, but increase, so you're basically regenerating blood vessels and nerves. So increased orgasmic strength, sensation, tightness of the entire vaginal canal. And then as you increase blood flow, lubrication is a function of blood flow as well. And so you get increased lubrication, which is huge.
And I mean, the whole point of foreplay is to increase blood flow. If you increase blood flow to the genitalia, you're going to have better sex.
Yeah, and we've talked about that frequently in other podcasts, kind of the raw podcast where it's like, men, you need to arouse because that's increased blood flow. So if you leave out the foreplay part of it and the arousal.
And wonder why you're not seeing what you want to see down there.
Yeah. Well,
turn that finger around.
Yeah. Or use it. I got it. So you're right. So arousal is part of that, just increasing blood flow and lubrication. And then those vaginal lasers do the same. So you have the Juliet, right? We have different ones. So the nice thing is we'll talk about them all. They all do the same thing.
People are always asking me, which is better? Again, you've heard me say this earlier about other stuff, Coke, Pepsi, RC Cola. I think they have subtle differences. I think that you can make an argument for any one of them being better at something, but at the end of the day, they are putting an energy in the vagina, whether it's heat. I mean, it's always going to be some form of heat, but whether it's from radio frequency or from lasers. And what we're doing is, I hate using this word, but we understand it, iatrogenic injury. We're causing an injury that we know will heal to leave a better outcome of what's currently there. And that's basically what we're trying to do, whether we're using radio frequency or laser or needles or whatever.
So a lot of what we use is non-ablative. So will you talk a little bit about the Juliet, because I believe that is an ablative, correct? And what that exactly means.
Fractional. So it's sort of like drilling holes. Each little tiny hole is ablative, but it leaves normal surrounding tissue around it to heal around the hole that we drilled. So we're not taking out the whole vaginal wall. We're just make these little pinpricks in it.
Okay.
And then the normal tissue around it will come up with a super healing type of response to that injury.
So you're still healing from the inside out because that
Exactly.
tissue on the surface is still intact.
Mhm.
And it's laser specific, right?
Mine's
Erbium?
laser.
Is it an herb? Yeah.
Erbium, yeah.
Yeah, because it's all differs a little. Again, you're right. It's all using heat to tell it.
That there's injury to repair.
Yeah.
Yeah.
We know this has worked in aesthetics, and it's been a slow move to get it into the, sexual wellness or women's health for a long time. But we know it works aesthetically on the skin.
We see it on the face.
Yeah.
So we see it on the face. You just can't see it in the vagina, but it's doing the same thing.
Yeah. Yeah, because they know about microneedling, which has been around a long time. They know about PRP because we put it on top of our microneedling, and people come in and they want it and they love it. And then again, Morpheus or Secret, like the different forms of radiofrequency microneedling, which you're just driving energy in, so it's the same concept, injury by heating in some way, and then repair, again, collagen, elastin, blood flow and nerves, all of the same things. So basically, so again, the entire vaginal canal coming to the outside. So what you do the Juliet on the outside as well, right?
We do.
Okay.
I think, from what we've talked about, it seems your practice is much more advanced and you have much more experience with the aesthetics. The town that I'm living in, it's not something that's sought after very much.
Yeah.
But then you go to LA or Miami and they've got clinics that are nothing but vaginal aesthetics shops.
So I will say here in Knoxville, you wouldn't think that people are actively seeking it out either, but you'd be surprised how many women, once they can see what we can do and what we can actually change functionally, they're like, well, why not? I want that. Why wouldn't I want that?
And
Let's do that.
I'll tell your listeners, I've seen your before and afters, and they are absolutely remarkable.
Yeah, it's pretty.
So it's been education, I feel like, in Knoxville, just the word getting out, people telling their friends, word of mouth.
Well, I think, again, it's hard to get to the public because you can't show before and afters on social media of a vagina. Yeah. You can, I think, on certain ones, like if you're on Snap or you're doing, there's certain ones you can. And some of the plastic surgeons are getting a little more open about that surgically. But a non-surgical labiaplasty is what we're talking about. And so we have radiofrequency. So it's kind of different than laser, but the same type of treatment that you have. Ours is radiofrequency, yours is laser. And again, one of ours stays on the surface and heats, and one of them goes inside the microneedling. So we have like Morpheus for the vagina now. Mm-hmm. And then this is something different. So we saw improvement too, but George, we didn't see anything. I didn't even know you could do this until it's that Photona laser we started doing, the 4D on the vaginal canal. And so the first one they brought out, it was amazing. So I don't think anyone really knows you can get that kind of response. And I think it's mainly because you're talking mucosa inside, and outside on the face, you're talking skin, and it's a transition zone in between. So I think the response after an hour treatment is amazing. But I don't think anyone really knows you can do it because even the company was kind of unaware when we went to the last. They didn't expect the before and afters that we showed them.
Oh,
so, no.
Dr. Durst did one talk, and by the second talk the next morning, it was standing room only just because the physicians had all talked amongst themselves the night before and was like, you've got to see these before and afters. It's unbelievable what we can do.
So you just got to make a trip over and bring your significant other. And then you see the transformation in person because, again, it's hard to put on social media. But we were like, hey, let's do word of mouth. So we did a big event. And now it's on the website. And now we've done, but everyone that comes in the office basically gets those pictures. And they're like, would you think I need it? And if you're doing the other treatments, you're like, of course you need it. Like, who doesn't need it? If you have a vagina, you need it.
Right. We can lighten, tighten, and brighten.
Yes. Yeah. So.
Yeah.
Because we can do it on the outside. Like, again, Juliet does it. Votiva does it for us. The Morpheus can come, but not a 1 hour, no pain, no downtime. And, some before and afters that, if anyone's watching it on a YouTube, will at least, put the link in where they can link on and see some of them. But yeah, again, so like one plastic surgeon was talking about a double in his surgical labiaplasties in 2021 because of yoga pants and camel toes.
Crazy, right? He's just shaking his head.
George is very infrequently speechless, but then I know he's only speechless right this moment because his mind, you can see him.
Oh, yeah.
Yeah.
Trying to stay appropriate in his response.
Yes.
I mean, I operated in that area for decades. And the idea of not having to take a scalpel and help a woman with, labia appearance or stress incontinence is just it blows my mind, and it's so much better compared to the surgeries that we would do. I mean, I would never allow a woman I cared about to be cut like I used to cut people when these other options exist, until these other options were exhausted. But to be honest, have you ever seen it fail in anybody? No.
No.
Everybody improves.
Yeah.
Again, it's just like other regenerative treatments. Some women take more than one treatment.
Yeah.
But
they all improve.
We get those results.
And I don't ever tell anybody we'll expect it to be perfect. If we improve it, that's the goal. But 95% of the time, you fix it, but you always improve it, and you do it without cutting them.
Yes, correct. And isn't that amazing to hear from a surgeon that used to perform the surgeries? But again, like I always say, as soon as you put a knife to it, if you can regenerate it, because you're regenerating too, you know, there's always those, cases that are more severe, there's reasons why a laser would not be indicated.
True, but even in ortho, right? We do steroid injections, we do hyaluronic acid, we do everything that we can prior to surgery.
Yes.
Well,
why not? Same for vaginal health.
This is a whole podcast in of itself, and it's geared at a very small population, but look at the improvement on your lichen sclerosus patients.
Correct.
Yes.
Yeah. Oh, yeah.
I mean, we're talking about women with debilitating issues in their genitalia that have new lives after doing this. Usually, I'm pretty sure you do the same thing. PRP. I combine my laser treatments with PRP, platelet-rich plasma.
But those are like the only treatments for it. Like they're on steroids otherwise topically that don't show improvement, just help with symptoms.
And can increase atrophy.
I mean, it totally thins the back.
Make worse symptoms.
Yes.
From the medications.
Yeah. And daily steroid use for a long period of time. The only treatment. Yeah.
And cholesterol is what is it? 10,000 times stronger than hydrocortisone. I mean, it's just crazy.
Yeah. No, it's amazing. So, and again, I think we do need to do a podcast on that at some point for sure, because I think that is something that women still don't know a lot about unless if they're looking for it. So they're not getting those suggestions at all from their primary doctor or urologist, but if they're looking for it, they find it and then they end up in front of you. So I think if we can get a podcast about that, that'd be a great idea. So.
Absolutely. So now let's talk a little bit more. So we started to talk a little bit about the Juliet, about yours. So for us, when we have women come in and they're doing our Votiva laser or our Fotona laser, we don't have any social downtime. So then they can leave this office. They can be intimate that night. What about with the treatments you're doing in office? Are you guys seeing that downtime?
No, I mean, same thing.
Or same.
We do have to, when I say the word warn, we'll let them know one of the reasons why we're doing this treatment is to increase vaginal lubrication. And it can really increase, especially the first few days. And you have to warn women sometimes because they're oftentimes very surprised at how copious that can be. We have to tell them that it's going to calm down, but the whole point is to increase lubrication, and you're really going to be lubricated the first few days. So while we tell them that they're totally free to have sex, they're not going to hurt themselves to have sex. Some of them find that it's a little over lubricated the very first couple of days.
Okay.
They're a little self-conscious about it.
Okay.
And I think that the Juliet's probably a step in between that and Morpheus, which Morpheus can go to 4 millimeters, in depth. Right. So I think even just downtime for 72 hours period for that,
with Morpheus,
is, and that's probably a step in between, versus surface heating with Votiva.
Votiva or Fotona.
But brings us to 2 huge points you just mentioned: tightening and lubrication. So again, in the third point, orgasmic strength, so things they didn't expect to get, is a really significant increase in lubrication, right? Even
Oh,
over
shoot.
time, not just in the first few days, but
Right.
over time.
Yep. We tell them that, but they don't really understand that. completely.
Estrogen is huge. There are some women who can't be on estrogen due to things like maybe a breast cancer that's estrogen positive.
Mhm.
But it is fantastic for lubrication. It does build up the vaginal wall, like you said. But the tightening is, well, that both partners are happy about that.
Again, but lubrication's huge for perimenopause and menopause. And I have some like older ladies that will go up on their estrogen just for lubrication. And it's really about regeneration because we can go up, but they're still not going to be lubricated. But it brings us to like hormone optimization is key for lasting results for any of this regenerative, that the treatments that we're talking about. But still, the regeneration is going to get you way more lubrication. And then that tightness. So tight and wet, a thing of the past doesn't have to be.
Doesn't have to be a thing of the past.
No, it doesn't have to be a thing of the past now.
And the tightening is remarkable. I mean, it's a noticeable difference.
Yes. Yeah,
Absolutely.
I agree.
And
then
you kind of hit on hormones real quiet. You just kind of like slip that in. I think with anything that we're doing regenerative, we've always got to tell patients.
I'll step right in and tell you, I'll have women that know we have the laser. They'll come in. They're not on hormones. They have no contraindication. And I'll tell them before I'm going to stick that laser probe in there and start, heating up their vaginal tissues, they have to be on estrogen first.
Yeah. Oh, yes.
And because again, the foundation is the foundation.
That's
The
it.
hormones are the foundation, and just jumping ahead of it, they're neglecting the biggest reason. And then once we've got the vaginal tissue supple and more blood flow going to it and younger, basically, then it's going to handle the energy from the laser or the radio frequency or the microneedling, and it's going to heal a whole lot better than if you just go in there and there's no hormonal replacement at the beginning.
It's that, why are we here in the first place? What's changed? Those hormones have changed. They've caused atrophy. They've caused dryness. We have to fix that fundamental change first to have sustained results, or we're going to end up right back where we were.
And again, orgasmic strength being, get your orgasms back. Women all in perimenopause and menopause lose orgasmic strength. It takes them longer. Every single one of them is complaining about it. And again, it can bring it back.
It absolutely is beneficial in that aspect.
Yeah. And they don't talk about that. And you won't hear that from laser companies either, which is fine.
It's okay.
That
They
is
can't talk about it. But
correct.
we can.
Yeah, we can.
We can.
Which is nice. Again, if you have any dryness, vaginal pain, decreased orgasmic strength, tightening, stress urinary incontinence, and
The appearance. I mean,
appearance.
as
That's
women
true.
get older, it often becomes darker and they're looking for a more youthful appearing vagina. It definitely helps bring back some of the pink and decrease some of the darkness. And then
Tightening,
labial
lightening,
size.
And brightening.
Tightening, lightening, and brightening. And again, labia size is huge. And we've actually seen, and I'll show you a couple of pictures of post labiaplasty. And we did the Fotona on it and the 4V,
Oh my goodness.
and it's amazing.
It's amazing.
Yeah. And so again, every single woman happy with that because they don't think, and I did ER and you did urology forever. Like I tell everyone, I never thought in the 25 years of all the vaginas I saw in the ER that they needed to be prettier. They just were all different, but now we can make them prettier. So
Today's grooming habits or lack thereof, I mean, because there's nothing there anymore. It's a lot more exposed, obviously, so it is, more visible. I think that's where the big
true.
difference.
That's a good point. That's a good point. That has changed. Yeah.
I mean, think about it. We do Brazilian laser hair removal. Why?
I know. Absolutely.
Because of the trends.
Yeah. Yeah. You never know where that might go eventually. It might be back, right?
Everything's cyclical. It seems
It might
like
be bearded again.
the flares are back. We're got the bell bottoms back.
Might be bearded
Might
again. Who
end up-
knows? But yeah. Well, definitely thank you for coming on and talking about how we can, again, make vaginas beautiful and tight and light and bright and lubricated and all the things. So, and again, if you have any questions or concerns or experiences, you want to share, please drop them in the comment, like, subscribe, share with friends. Sharing is
Caring.
caring.
Always.
Of course, we always say. And thank you so much, Dr. Ibrahim, for
Thank you, Dr. Durst.
coming on. And we appreciate it.
Thank you for joining us.
Take care.
Thank
Bye-bye.
you.